claim. The affirmative claim that medical marijuana is not dangerous in comparison to other drugs in Schedule 1. Start off like that. The affirmative also defines Schedule 1 and Schedule 3. However, they do not provide evidence that marijuana is not dangerous. So I'll be refuting a point that wasn't actually proven, that marijuana actually is dangerous. According to the Oxford Journals, controlled substances are drugs that have recognized its potential, and marijuana remains a federally Schedule 1 drug because it is widely abused in the United States and around the world. A comprehensive study on all of the laws about medical marijuana in all 50 states says that regular use is associated with diagnoses of marijuana use disorders. Such disorders are associated with marijuana withdrawal, unemployment, personality dysfunction, crime, respiratory problems, and other psychiatric disorders. That does sound to me like it fits the Schedule 1 definition of drugs that have a high risk of abuse and have adverse effects that are pretty high. The second claim is that those who cannot access this amenity are being deprived of the benefits it can provide. The affirmative enters into circular argumentation with their second claim and then also the first subpoint of the third claim, the gist of which is that medical marijuana helps with illnesses and diseases such as, treatment for cancer, PTSD, uneasiness, such as nausea, stuff like that. First, there are already plenty of treatments that actually do help with that already that are currently legalized, so there's really no need to have marijuana legalized. The National Institute of Health states that acupuncture, a complementary therapy used in symptom management, is used clinically to manage cancer-related symptoms, treat side effects introduced by chemotherapy or radiation therapy, boost blood cell count, and enhance lymphocyte natural killer cell activity. In cancer treatment, it is primarily used in symptom management, which is what the affirmative is arguing that marijuana will help with as well. It's also treated symptoms as pain, nausea, and vomiting. Other symptoms that affect a patient's quality of life, for example, including weight loss, anxiety, depression, insomnia, poor appetite, fatigue, something I can't pronounce, hot flashes, chemotherapy-induced peripheral neuropathy, gastrointestinal symptoms, so like constipation, diarrhea, and another thing that sounds really terrible, honestly. So further, acupuncture is also safe for children as well. More than that, another article from Livestrong states one of the primary uses of medical marijuana is for pain control. However, over-the-counter medications such as acetaminophen, ibuprofen, so Motrin, Tylenol, things like that, and other prescription medications such as codeine, they serve as safe, effective alternatives to medical marijuana. So they're already in the system. They're safe. They've already been FDA approved. A report in the British Medical Journal that reviewed 9 trials that compared marijuana and other pain medications found that marijuana was no more effective than codeine and ibuprofen, especially when treating acute pain that is chronic and then also the symptom of cancer as well. Some conditions may respond better to certain pain medications than others. It's just a matter of talking to your doctor and stuff. So because there are already so many pain medications out there, there's really no need to talk about, bringing in something else that's not even FDA approved. Further, anti-nausea medications, cancer patients in treatment and chemotherapy or radiation, and other people suffering from nausea, they may reach for marijuana due to its anti-nausea properties. However, there are other prescription options for nausea relief. I'm sure all of you have heard of the Dramamine that people take on airplanes, keeps them from vomiting, stuff like that, helps with motion sickness. Another one is Zofran. That's actually, you need a prescription for that. Non-prescription remedies, so those are also, ginger, taking a little soda, like cups of soda, stuff like that. Those are also available. So that's already a bunch of stuff that is already FDA approved. Moving on to The third point, moving medical marijuana from Schedule 1 to Schedule 3 federally would benefit medical patients and the government. I'll be skipping to the second and third points, which are medical marijuana would stimulate the economy and crime rates will decrease. So the first one, I'll be refuting that other legal drugs would also stimulate the economy. You know, heroin brings in close to $130 billion. Cocaine, lots of money in that too. We could legalize that, you know, maybe reduce some of the debt that America's gone into. That doesn't mean we should. A United Nations study, this was done in 1998, so the numbers have probably gone up. It says that with estimates close to 100 billion for heroin, 10 billion for cocaine, the probable global figure for the total illicit drug industry would be approximately 36 billion. However, they use conservative numbers in that, so actually 400 billion per annum is considered realistic. Also, their source was the Colorado Pot Guide. So that doesn't really seem like a very refutable source. And then, I mean, they didn't even kind of try to make their title useful. It's not even a government website. So it's biased, first of all, and second, it's a guide on how to use pot. They claim it will help the government. Well, first of all, they talk about, you know, crimes that weren't justified, but they didn't specify which kind of crimes weren't shown in relationship to marijuana. Also, if there's another agenda being shown here, such as, you know, legalizing it to keep down crimes, then they should leave the medical community out of it. Thank you.